The SAV2500 small animal ventilator is designed to be used on veterinary patients by trained veterinary professionals. This video will review how to set up the SAV2500 small animal ventilator. The first step to using the SAV2500 ventilator is to pressure test the anesthesia machine to make sure it is leak-free and in proper working order. Refer to the anesthesia machine's daily leak test procedure if necessary. Once the anesthesia machine is pressure tested and leak-free, you can connect the SAV2500 ventilator. There is an optional universal ventilator mounting bracket that can be used to mount the ventilator to a pole-style anesthesia machine. The ventilator is supplied with all required accessories. Attach the bracket stem to the bottom of the ventilator. Insert the bracket stem onto the mounting bracket and secure by tightening the set screw. Position the ventilator so you are viewing the back side of the control head. The adapters will be attached in order from left to right. On the far left side, you will see the transport breath button. This is a pneumatic control that can be used during transport or power loss. The exhaust port is where the drive gas escapes, and scavenging is not necessary on this port. The main power supply cord connects to a power pack, which then connects to an electrical outlet. The fuse housing contains a 250-volt, 1/2 amp fuse. The drive gas inlet allows connection of the O2 supply to operate the ventilator. This is a standard O2 DISS fitting. The drive gas supply port accepts one end of the short 12-inch cuffed hose and connects to the drive gas inlet on the bellows base, utilizing the 22 by 22 mm plastic adapter and 22 by 17 mm silicone adapter. The pressure relief valve connects to the drive gas supply port. The numbers on this relief valve can be used as a reference, but true circuit pressures are determined by the manometer located on the anesthesia machine. It can be set to a desired pressure of approximately 10 centimeters H2O when fully open and 60 centimeters H2O when closed. The gas evacuation port is where the expired gases are scavenged from the circuit. To connect the scavenged tubing to this port, the purple 30 mm by 19 mm adapter is necessary. The supply hose inlet is where one end of the 48-inch cuffed hose is connected. The other end of this hose connects to the bag port on the anesthesia machine. Connect the DISS Y piece to the back of the ventilator at the oxygen inlet. Connect the 24-inch green oxygen hose to one leg of the Y piece and connect the other end to the DISS fitting on the anesthesia machine. Connect your main O2 supply hose to the other leg of the Y piece. Please ensure that the regulator connected to your main O2 source is providing 50 to 55 psi. It is not recommended to use an oxygen concentrator with this equipment. The SAV2500 ventilator has 3 control knobs. The knob on the left controls the inspiratory flow, which affects tidal volume and pressure. Turning this knob clockwise increases the volume and pressure of the breath delivered. Turning it counterclockwise decreases the volume and pressure of each breath. The center knob manages the respiratory rate. Please note this is variable based on the other control settings. The knob on the right controls the inspiratory time. Normal inspiration is about 1.5 seconds in length. The longer the time spent in inspiration, the larger the breath. The opposite is also true. The shorter the time spent in inspiration, the smaller the breath. Please note that it is strongly recommended to properly monitor patient pressure and end-tidal CO2 when using the ventilator. Please refer to the clinical support links available on the website regarding ventilation and patient monitoring. Connect the test lung to the patient F circuit. For initial startup settings, turn the inspiratory knob all the way counterclockwise and then turn clockwise a quarter turn. Set the breaths per minute to 8 to 10. The inspiratory time should be set just left of center. Completely inflate the bellows using the oxygen flush valve, and then turn your flow meter knob to deliver 1 liter per minute. The bellows should hold in the full position. Turn the ventilator on. You should hear the bellows fire but not move greatly. Increase the inspiratory flow very slightly and refer to the pressure reading on the manometer located on the anesthesia machine. Adjust the knobs on the ventilator to deliver the desired ventilation for the patient, determined by the attending veterinarian. Once this is determined and the controls are in the proper position, you can turn off the ventilator. The machine will hold these settings until the time you need to attach the patient. Thank you for viewing this clinician training program. For further troubleshooting assistance or additional questions or information, please contact SurgiVet Clinical and Technical Support at 800-258-5361.